Still watching Breakfast Extra. Our Wellness Central today is a special segment as we are commemorating World AIDS Day. Now, it's a moment to reflect on the progress made in the fight against HIV and to remember that the battle is far from over. The 2025 theme, Treatment Saves Lives, while prevention and care still matters, reminds us that while treatments are available and effective, staying safe and accessing care remains critical for everyone.
And to help us unpack this important topic, we're joined by Isaac Moses, who is a service delivery lead at Youthful, Alive and Healthy Nigeria. Isaac will guide us through the importance of prevention, testing and ongoing care, especially for young people, and share practical ways that we can all play a role in stopping the spread of HIV. Isaac, thank you so much for joining us. We appreciate you for coming on.
Yeah, thank you very much. Good to have me on the show. Thank you.
Now, Isaac, can you give us an overview of the current HIV situation in Nigeria? What are we looking at, especially among young people?
All right, so currently when we look at the HIV situation in Nigeria, you agree with me that based on the latest data that is available, that's the Nigerian HIV AIDS Impact and Indicator Survey. That data reveals that our prevalence is at 1.3, and that means that about 1.9 million persons are living with HIV currently in Nigeria, and that's from the ages of 15 to 45. And when you look at that, young people have a larger proportion of this HIV burden in Nigeria. And then looking at some of the ongoing efforts that have been that have been happening in the current landscape of the HIV response, you have that for a while now, the country have adopted the treatment as prevention approach. That means that we are trying to achieve the 95 targets. And this means that 95% of persons living with HIV needs to know their HIV status. And then among these 95% of persons that knows their HIV status, 95% of them have to be placed on antiretroviral treatment continuum of care. Then out of these 95% that are placed on treatment, we also want 95% of persons on HIV treatment to be virally suppressed. And so there is a scientific fact with evidence that shows that when persons living with HIV are virally suppressed, the chances of transmitting the virus to another person becomes very, very negligible. And that's the reason why the country had to adopt that scientific approach. So this means that HIV is no more a death sentence, it's no more a threat. And so far, we've seen that our treatment as prevention approach has really helped us as a country to have a very good epidemic control in the country. So when we look at that performance, considering the 95 cascade, we see that as a country, we are still doing about 87% for persons that know their status. And then for those that are on treatment, we are at about 98%. That means we have almost 1.6 million people. Among there are about 1.9 million persons living with HIV. About 1.6 are already on antiretroviral treatment. And among these people that are on antiretroviral treatment, we are already doing well at about 95% viral suppression. And this means that not just at the individual level we are making progress, but as at the population level as well, because the rate of transmission of HIV is becoming minimal. However, we still see that there are still a little gap, especially in the areas of pediatrics and in the area of PMTCT. In the area of pediatric, we are still coming up strong with response to advanced HIV disease, as the AHD, which is something that the country is looking at directly right now, and also in the area of PMTCT to ensure that no child that is born to an HIV-infected mother is having the HIV virus. And of course, the present Director General of NACA, currently Dr. Temitope Ilori, is taking that as a core priority, looking at PMTCT and looking at pediatric and also looking at adolescents HIV. That also covers the young population, adolescents and young people population. It's a priority right now for the country to ensure that the testing gap is well closed. Right. Because of course we know that we just don't want to say treatment alone is enough. But however, prevention and testing, of course we know testing is the entry point to treatment. And so we are prioritizing prevention and testing right now as a country, so that by the time we are looking at the cascade, the 95-95 cascade, we should be able to say that by 2030, which we are looking at this target, as a country, we'll be doing well and even surpassing the 95 target from the first 95, just like we are doing in the second 95. We're already at 98. And then for viral suppression, we are already doing well at 95. We hope that by 2030, we should be able to surpass all the targets across the cascade. Thank you very much.
All right, Mr. Isaac, the theme this year is treatment saves lives. Tell me, how has access to antiretroviral therapy changed the lives of people living with HIV in Nigeria?
Oh, wow. Yes. Like I mentioned earlier, when you look at the theme, treatment saves life. Of course, treatment saves life. I took us through the data and then also taking us through some of the scientific progress that we have made, looking at treatment as prevention. So when you look at about 1.6 million people that are already on treatment, that means we've been able to avert over thousands of deaths, including the suffering, the impact of AIDS. So there's a clear difference between HIV and AIDS. AIDS, it's the full-blown stage of a HIV infection, and you know what that means. It means that there is a lot of the person will be suffering a lot of opportunistic infection, and there's a lot of health burden, looking at the highly compromised immune system, which can then at that point lead towards death. But through the treatment program, the treatment as prevention program, among the about 1.9 million persons living with HIV, about 1.6 million are already on treatment. That means that we've been able to save life. We've averted thousands of deaths and also the suffering. Now, when you also look at it in terms of pediatrics, advanced HIV disease, you see that children are very, very susceptible to HIV, especially when there is vertical transmission from mother to child, and the chances of survival at that stage, because they are still developing, might really be a serious challenge for them to cope. But with treatment, we see that we've been able to cut vertical transmission from mother to child. That means many children are now safe. They can live without the HIV infection, which they would have ordinarily contracted from their infected mother. Then again, when you also now look at it at the population level, you will agree with me that because we already have about 95% success rates in terms of viral suppression, that means the chances of it takes two to tangle. You can only get this HIV from someone that is infected. So that means a person that is negative can contract HIV from someone that is infected with HIV. Why someone that is infected with HIV can transmit the virus to a negative person. But with the treatment that we are looking at right now, we see that transmission, that is prevention with positives, transmission has actually reduced. It means that our new incidence rates have been greatly reduced. So the number of persons that would have been infected ordinarily without being virally suppressed on the treatment would have also increased, which would have also resulted in some higher HIV deaths, age-related deaths in the country. So, but with the treatment, I think we've been able to achieve very good epidemic control. We've been able to save large number of lives. We've avert many deaths and suffering in the country. And again, we have been able to reduce new incidents in the country. So this is a clear evidence and a clear indication that as a country, of course, we have been able to demonstrate that scientific evidence that yes, treatment thus saves lives.
Now, as we're talking about, the treatments and the effectiveness of treatments that are available, just beyond that, one has to look at the concerted efforts of the government first. We know that USAID was paused after a while due to this current administration in the U.S. And there were some talks about it affecting HIV and AIDS program that was funded by USAID. Do you want to talk a bit about that? You are working closely with this NGOs and persons who partner with this. Was there any effect or any gaps so far since the stop of USAID?
All right, thank you very, very much. Of course, for people that are actually following the response in Nigeria, we know that large volume of funds are from external intervention. So with the USAID cuts of fund or withdrawal of their funds assets, some recently, yes, we see that there was some level of what impact in that, because quite a number of projects that are life-saving projects were a bit affected. But you will observe that in that memo, essential service were still maintained. We know that it also disrupts some kind of prevention intervention in some areas. But as a country, we saw the Nigerian government under the His Excellency Bola Ahmed Tinubu-led administration, we saw the Nigerian government respond very speedily with the release of some billions worth in naira to really quickly mitigate that gap, so that supply of ART is not really a pressure or a problem in some of those states that were really USAID funded states. And a lot of organizations also came very, very speedily, in the sense that we have to start looking at some other innovative approach, looking at differentiated service delivery, that's the DSD approach, and some other innovations to ensure that people that are on this essential treatment are not highly affected. So we see drugs taken down to remote areas through dispatch and through last mile delivery approach, through peer navigation approach, and a lot of innovations came on board. And aside the government responding in terms of funding to bridge that gap, we saw a lot of civil society organization, network, and even the healthcare systems as well, to see that we strengthen that gap. And if you look at right now, there is a lot of effort to also integrate some of these services into the healthcare insurance program that is happening nationwide. So persons that are living with HIV are also captured in the healthcare insurance scheme that is being powered by the government, to ensure that their burden and their priority needs are well captured and taken care of. So with some of this intervention, I think as a country, with the pain was not so felt. We've been able to bridge that gap, and of course, we are looking at that things will get better as we move on.
Now, Mr. Moses, with treatment being available, I'd like to know, why is prevention still, such a critical part of the fight against HIV?
Yes, thank you very much for that wonderful question. So when we look at prevention is still a key concern because of some certain factors that prevents the vulnerable population from accessing treatment. For example, despite the fact that we know that we are, as a country, we have moved away from just the awareness stage, we are now at the scientific stage. Stigma HIV stigma still persists in our community. Social stigma still persists. And of course, there are also punitive laws that affect the key affected populations due to certain high risk behavior that they are involved in. So there's some kind of barrier, this punitive law that prevents them from accessing service, including young people as well. Like I said, social stigma affects a lot of young persons. You know, you see a young person want to walk into a facility to ask for condom or to even ask for PrEP, and it's being stigmatized, and it's been like, have you started having sex? Why do you want to take PrEP, or why are you asking for condoms and all of that? So these are serious issues that is affecting our prevention intervention. And of course, when you look at healthcare providers, the attitude of healthcare providers as well, it's also affecting some of these populations as well. So prevention, there is still some certain gaps in prevention, but like I mentioned earlier, as a country right now, there's a lot of focus to ensure that prevention is a priority. So we have for the Nigerian government responding to that, reviewing the HIV prevention policy, and also reviewing the policy and guideline for adolescents and young people prevention, which is looking at a lot of other innovative approach. Where do we find these young people? Where can we reach them? So both digital platforms and multi-sectoral approach are being actually deployed. And we're also looking at there is also the funding challenge as well, because prevention is a very, very capital intensive. When you look at the large number of population, it means that you are trying to prevent HIV. So you look at the number of people that are already infected compared to the number of people that are not infected, and you need to program for them. And when you look at that number, you see that you spend so much in prevention with negative. But however, the government is looking at priority approach to reach most of the vulnerable populations that are highly affected. That is adolescents and young persons, key population, and of course women of reproductive age. We are very much sure, with also some kind of a mental health intervention being integrated, our prevention response will be coming up in the coming years.
Let's talk about efforts for underserved areas as we wind down. We're talking about the access to effective drugs, the antiretroviral drugs as well. But HIV care and treatment, especially in rural and underserved areas, what are we looking at in terms of accessibility and consistency with care and treatment?
Yes, so a lot of intervention are actually ongoing. For example, if we look at the entry project that is being powered by NACA, the entry projects funded by Global Fund in collaboration with the Nigerian government and coordinated by the National Agency for the Control of AIDS. And then we have quite a number of NGOs like IHVN, including the network of people living with HIV and AIDS in Nigeria, just in the spirit of let community leads. So our response have actually been localized, because there is this tagline that we are pushing. While we are thinking globally, we also need to act locally. So think globally, but act what's locally. And that has helped us to localize our response, so that communities are actually at the front line. So we have the community of persons living with HIV, and also community of civil society at the grassroots level. And these interventions are happening at the grassroots level, the subnational level, at all the LGA. So you see that hard to reach communities are actually being targeted, because this is where we see that the interventions, these populations are really underserved, and those are the areas that are currently targeted for the entry project. For example, if you look at Kwara State, you see some of those LGAs up north that are really underserved: Barotin, Kayama, Edu local governments, Patigi, Ifelodun local government, irrespective of some of the security challenges that we are facing. If you move down to the southwest in Ogun State, in Lagos State, you see communities, the riverine communities being targeted down to Makoko, Badagry, Ekpe, Ikorodu area, the Jede community. Those are hard to reach area. When you go to up the east as well, you look at Anambra State, Ebonyi State, you see that these interventions are going deep down into the rural communities, where these interventions are highly in need. And of course, it is the locals, the community people that are actually leading this intervention at the grassroots level. With this, we are beginning to see an improved response. More cases, new cases, people that don't know their status have been identified and placed on treatment. And as a country, we are using some of this scientific approach to improve our response. There is also the geolocalized interventions using technology and AI-powered tools to identify high burden areas, and this is helping us achieve what we call local epidemic control. We are doing the local epidemic appraisals to understand where are these new infections coming out from. There is also the EPCOM app that is powered by ECUs that is helping to target geolocalized intervention, to target those communities where these incidents are happening, so that resources can actually be channeled into those communities. And we believe that as we move on, there is going to be a lot of improvement trying to reach those hard to reach areas and remote communities that you have just mentioned. Thank you.
All right, Mr. Isaac, just before we let you go, you mentioned something about stigma earlier, and it remains quite a huge barrier for many. What strategies work best to reduce stigma around HIV testing and living positively with the virus? Briefly, please.
Okay, so in terms of addressing stigma, there is a lot of campaigns that is happening both at the community level and both at the structural level, that's at population level, and in terms of structural intervention as well. So awareness is also very, very key. Yes, we know that despite the fact that the level of knowledge has increased a while, and then we also have that our population is a dynamic population. It means that we need to sustain this awareness campaign, especially among young people. It's a dynamic population. A lot of young people will become 15 this year. They will want to explore. So in the next 2 years again, you see large number of young people that were children before becoming young adults. And then how do we really sustain this messaging so that for a dynamic population as such, the stigma issues are really addressed? So it means that the country is trying to use some sustainable approach to ensure that we have a lot of behavioral change communication materials disseminated across different platforms, both digital and remote platforms. Also leveraging the power of social media, influencers, and all of that. Then at structural level as well, there's a lot of training and retraining in the facility among healthcare service providers to ensure that they provide equitable and non-judgmental and friendly services to people that need these services. Then there is also the workplace policy that is actually being coordinated by NIBUCA. Private partners are also involved to ensure that persons living with HIV are not being stigmatized and are not losing their job due to their HIV status, also trying to raise that awareness to reduce stigma. Then, of course, there is the anti-stigma and discrimination law that is already being domesticated across various states right now to ensure that it's being enforced, so that people living with HIV are not being stigmatized or denied of any fundamental rights due to their status. So a lot of these structural and more sustained approach are still ongoing. Then, of course, in terms of BCC material, there is a strong partnership with MTV Staying Alive Foundation to produce more BCC material. We saw all of those improvements during the MTV Sugar series. This time around, we know that young people have very short attention span, so there's already an innovation lab that is ongoing with strong technical support by NACA and other agencies to ensure that We have more short films that are really talking about addressing stigma, addressing women and girl agency, addressing sexual and reproductive health issues to ensure that people are actually taking responsibility and taking their health and leading healthy lifestyle to also address all the stigma issues around HIV. So very soon we are going to be having an improved and friendly ecosystem that is void of stigma and discrimination. Another approach again that is working. We are beginning to see persons living with HIV come out to tell their stories from lived experience, how they are doing well on treatment, which also shows that yes, living with HIV is not a death sentence. And if you are negative, it's also good that you are negative so that we don't have more persons being in that positive light because of the cost of maintaining the treatment. And of course, again, there are other prevention tools, PrEP, pre-exposure prophylaxis. There's also PEP as well, post-exposure prophylaxis, that can help people that are negative prevent HIV infection. So all these interventions are actually being rolled out, and at the same time there is this stigma reduction component across all the various interventions to ensure that stigma is reduced. Thank you very much.
Thank you. Isaac, thank you so much for coming on and sharing your insights with us. Today, World AIDS Day is going to be on the 1st of December. We do employ everyone to make sure to go get tested, know your status. Also, prevention, treatment, and care is not just informative, but also truly empowering. And you've done justice in talking about how treatment is, save lives, but how prevention and care is ongoing, but is also very important. Isaac Moses, once again, thank you.